Hi, welcome to Golden Years. This month we have Denise, Vaca from Hospice of Medina County. So come on back and she will give us updates on what's happening in her world.
You have the time to give and your country needs you. Take what you learned during your life and apply those skills to your community. Shape tomorrow by being a mentor and tutor for children. Make independence a reality for people to continue to make their house their home. Make a difference today. Get involved.
Welcome, Denise, to Golden Years. Thanks for being my guest this month.
Thank you for having me, Lori.
And how long have you been with Hospice of Medina?
I have been with Hospice for 11 years now. It's hard to believe.
Time flies.
It does. It really does. Yes.
And that was in our youth.
Yes, really.
And I see you out there a lot at a lot of the meetings, the Senior Net meetings and the Parma Service Senior Network meetings. What do you do in your job?
Well, my title is Community Relations Coordinator, which is a mouthful, but I like to call myself a community rep. My biggest role is going out into the community and educating them on hospice and the hospice philosophy. There's a lot of myths out there. A lot of people think that hospice is just one big happy family. They don't realize that there are so many different hospices out there. And so I feel I have job security in educating not only the layperson, but the healthcare professionals as well.
And you have such a good personality because when you hear hospice, I mean, in the olden days, it meant you're on your way out.
Absolutely. People are very afraid of the word. Many times when I'm sitting either at a health fair or some event that's taking place, people see the hospice sign and they'll just try to walk as far away from me as possible, because people think of hospice, they think of death. You know, hospice today, death tomorrow. And that isn't the case. We have people on the program for quite a long time. Depending that they're meeting the criteria, they can stay on the program. So it isn't just, you know, something that if they sign on today, they're gone tomorrow.
I know my sister has an issue with liver cancer. And she had her last, 2 months ago, she had her chemo, and she really went downhill instantly. And the doctor right away said, hospice, call hospice. And in her mind, she automatically said, no, I'm not ready for hospice. And we said it too. And I tried to explain to her that times have changed. You know, their program has changed. Because years ago, like I said, you had to stay home. I remember my girlfriend, she couldn't take her mother anywhere. You know, she said, because if she knows we're going out into the community, they will pull all services.
Yes, and that has since changed, and thank goodness for that. It used to be that it had to be 6 months or less life expectancy. And now we're seeing that when we talk to the physicians, if they feel a person has with their disease, if the disease would continue on without any type of treatment, we'll ask the physician, do you feel this person would be around in a year? And if the physician says no, then they're very much appropriate for hospice. There's also certain criteria that we have to follow, and we ourselves follow the criteria from the National Hospice and Palliative Care Guidelines. So a person has to meet that criteria in order to be appropriate to be on hospice services. Sometimes what we'll do too for people that are kind of, they look like they meet certain criteria of one terminal diagnosis, what we do is we'll put them on the program and we'll watch them real close for the first month. If it seems like the disease is more chronic than terminal, then we'll take them off the program. So there is that buffer there that we can work with. And you brought up another good point about people think that hospice is just for cancer patients. And it isn't. It's for any type of an end-stage illness. End-stage heart disease, end-stage respiratory, dementia, sometimes just the frailty of old age. You know, you're getting all those symptoms and such that people are very much appropriate for hospice services.
And hospice can be any age, correct?
Yes, absolutely. It used to be years ago, people thought of hospice as, oh, somebody in their 70s or older. However, that is...
70s is young.
That is changing. We even have ourselves a hospice program for children. So any age with a terminal illness and wanting not to have aggressive treatment would be appropriate criteria for hospice.
Can the person stay in their home? Will you go to their home?
Absolutely. Hospice was designed that it was to aid a person wherever they live. And most people, if you ask them, where do you want to die? I know myself, I would say I want to die in my own home with my possessions, with my family, with my pets, everything around me. And we try very hard to accommodate a person for that. However, sometimes because of the illness or maybe because of lack of a caregiver, a person might have to be placed. So we do service in assisted livings, nursing homes. We even do hospice in the hospital for folks that maybe are just too frail and wouldn't make the trip home.
So the hospital will keep them in there then
Yes.
for a length of time?
Yes, they'll keep them in there. What will happen is they're not actually in the hospital. They're in a hospice status, so to speak. So hospice is coming in, we're using the bed space in the hospital and helping the person live out their final days there. With hospitals, the way they're set up today, they need those beds for acute care. So they don't always like to have a person staying too long there. And if that's the case, many times we can move them to our inpatient unit, which works out really well. Again, hoping that they can make the trip. Sometimes they can, sometimes they can't. So it's a judgment call on the physician, on our nursing staff to see, if that person could make that trip.
Okay. And years ago, it used to be hospice of the county, any county. There used to be one main hospice. How come there's so many organizations out there now?
There's a lot of hospices coming out. People get very confused with that. They think we're just one big, again, happy family. And there are hospices that are for-profit, for non-for-profit, which we happen to be. There are some that are an extension of a hospital system that you'll see. There's big corporate major ones. We ourselves, we got our start back in September of 1981. And so that we're going to be celebrating 30 years coming up this fall.
How exciting.
We're
And
really
you have exciting
amazed.
news we're going to work in before the end of the show.
Yes, absolutely. So, the name is very confusing. And we have thought about wanting to change the name because people think we only service Medina County. And that isn't the case. We have always serviced the surrounding counties. We go into Cuyahoga, we go into Lorain, we go into Wayne, Ashland. Now with our Barberton office, we service more of Summit and Stark, but we've always serviced those surrounding counties as well as Medina County. So we're very happy with that. So sometimes the name can be a little bit confusing, but we did not want to change the name because we got our start in Medina County and they have been so good to us. And that name will continue.
And that's
Yes.
good. And that's how a lot of us do know.
Yes.
My girlfriend's mom went on hospice. And it is very, I don't want to say secretive, protective. It is zippa your lippa. And I know because when I would ask you about a patient, and you're like, okay, I don't know names, and we don't talk about names. But I just wanted to share with you, her mom needed so much equipment. Every time the nurse came over and said, okay, how about a Hoyer lift, a hospital bed, whatever she needed, the equipment appeared. I mean, you guys did not deny anything. You were so concerned about that person being comfortable.
And I think that's one of the great things about hospice services. People will say to me, Denise, why should I sign, my loved one onto hospice? What can you offer that they can't get, at where they're at? Maybe they're in an assisted living or in a nursing facility or even private home. And I'll always say we can offer not only the comfort care and the support, but we can also offer, depending on what the terminal diagnosis is, durable medical equipment for them, a hospital bed, overbed table, oxygen, maybe a bedside commode, perhaps a wheelchair, any of those DME equipment that they need, and nothing would be paid for out of pocket by the patient or their family. On the same end as well, we can offer medications for the person. So if the terminal diagnosis is, let's say, cancer, we would be always paying for pain medications, any type of medications related to that terminal diagnosis. And again, for some people, that's a big help with the cost of medical equipment and with the cost of medicines. That can be a big, big help for them as well.
Your nurses are phenomenal. I only hear
Thank you.
good reports about them.
Thank you.
Now, do you do any, like, I don't want to say babysitting, but like, let's say the caregiver needed to run out or have a day out or something.
Absolutely.
Do you have sitters?
Absolutely. We have an interdisciplinary team of nurses, doctors. We have, I believe right now, 6 medical directors under the direction of our chief medical director, Dr. Ken McCormick. We also have social workers, we have nursing assistants, and then we have a great group of volunteers. So that whole team works with the patient and their family. If a family member would need to run out, maybe to go shopping or go to a doctor's appointment themselves, or lunch just to get away, we have trained volunteers that will sit with the patient and stay with them and meet their needs, whatever those needs may be. We're very, very fortunate. I believe at last count we had close to about 220 volunteers. And it's amazing when you think, caring people that aren't getting paid for this, but are so, so dedicated. A lot of our volunteers too had loved ones on our program and lost them.
So they return.
And they're returning the favor, and that is really great. And there are so many volunteer opportunities for direct patient care and indirect care as well. Some people will say, oh, I'd love to volunteer, but I don't know if I could do the patient care. It might be too hard for me. But there's plenty of opportunities for office work, fundraisers, that sort of thing. Sometimes people just running out, a volunteer running out to the pharmacy, picking up a medication, bringing it to the family, bringing it to their home. I mean, our pet therapy, that's one of my favorite ones, where, you know, the volunteer and the pet will come visit. And so many times I see it as a nurse and as a hospice worker, that when a human can't touch the person, the pet can get to that person in so many ways without words.
Oh, that's touching.
It's just amazing. Yes. So we're very, very fortunate for our whole staff and especially our volunteers. They are wonderful people. We appreciate them very, very much.
Great. And you guys, like I said, you have good personalities, and you could tell you want to be there for the patient and for the family.
Absolutely.
I went into assisted living a couple weeks ago, and there was a volunteer sitting on the couch, and I started chatting with her, and she said, well, I'm with the family right now, and they're just having their time with the family member. And she sat there and waited, and I thought, oh, how touching.
Very dedicated. Very, very dedicated.
All right, do a blurb about your life's treasures.
Okay.
You have to tell them what that's all
Well,
about.
in the 11 years that I've been with hospice, we really have grown and added so many more dimensions. And one of the dimensions that we've added on is Life Treasures, and that is our resale shop. And when our executive director, Pat Stravko-O'Leary, wanted to open this, I thought, why are we getting into retail? You know, couldn't quite understand that concept. Well, it's turned out to be a wonderful, wonderful shop that we accept donations, and then people can come and shop there, and it really is upscale.
Oh.
The group that helped put that together and keep it running have really kept it really fun. You know, it's not your typical junky kind of stuff in there. It's really neat treasures. As the name suggests, I can't go in there because I'll go in there with a box to drop off as a donation and come back with 5 or 6 boxes. And I'm like, no, this wasn't the idea. But it's really lovely. It is located right off the square, south of the square, on South Court, I believe that's called there. Right across from the Farmers Exchange.
Okay.
Okay, yeah. And you just have to come and see it. They have I can get the hours for you. I'm sorry right now, but I do know they are open half a day on Saturday and till 7 p.m. on Thursdays. But they are open the other days of the week as well.
And on nice days, because I've gone by, they do have featured items outside.
Yes, they do. There's conveniently a stoplight there. So when you stop, you can look in the window and see what's in the window and what's outside. Yeah, that works out really well.
And someone else's, I don't want to say junk or whatever, is someone else's treasures.
Absolutely, absolutely.
So if you want to throw something away or donate it, think
we're
of Hospice.
Always accepting donations, yes.
And this year you added the Christmas store.
Yes, that was something neat too. Yes, they took a portion of the shop and they made it a Christmas shop. So it had all kinds of decorations and Christmas trees and holiday treasures that people would enjoy. It was really neat. Went over really big. I have a hunch we might be seeing
Expanding
that again.
that? Oh yeah, I mean, I have so much stuff about my Christmas stuff. To me it means something, but to someone else in my family might not want it. Well, then donate it.
Exactly, and I'd much rather see it being used. It's so wonderful because all that money goes back into
the program.
taking care of our patients, and that's so wonderful. In these tough economic times, that works out fantastically. So, Pat was very intelligent with that one, yes.
And it worked.
And it
Good
worked,
for her.
yes.
Good for her. Okay, we're going to take a quick break, and when we come back, Denise is going to share with us what exciting news Hospice of Medina County is approaching.
Dinner makes a difference. Learn more at casafamilyday.org.
You can never know which pool safety step will save a life. Until it does. No matter how safe you feel, adding multiple safety steps can mean the difference between a close call and a call to 911. Simple steps save lives. To learn some new ones, visit poolsafely.gov.
Welcome back. I'm interviewing Denise from Hospice of Medina County. And Denise, share with the audience the wonderful news. Tell us what's happening with Hospice.
Well, the big news for this year is that our building is coming to fruition. Finally, we're so excited. The construction that you see on Route 18 and Windfall is the new Hospice of Medina County building that is slated to open up in the fall of this year. So we are so excited, and we need it so desperately. It will house our hospice offices, our bereavement center, our Bridges Home Health Care, which is our sister facility, and it will also be our inpatient building.
How many beds?
16 private rooms. And from what they're telling us, I haven't been actually in the building yet, the 16 beds will be on the back of the building. all private and all facing a beautiful wooden park-like setting for our patients and their families.
Will they be able to go outside?
Absolutely. It is made, it is specially designed that they can go outside, whether they are ambulatory or even if they can't get out and they have to go out via a bed. The door will be opened wide enough that they can be out there and enjoy the sunshine.
So
and
right
the
off their room?
Right off of their room,
That's
yes.
awesome.
Yes. So we are so looking forward to that. It's just amazing.
And
Can't
when's
wait.
the move-in date?
Well, for the staff, we're hoping that we're going to be in there about the beginning of July.
Okay.
But the actual opening of the building for patients will be, we're thinking about in September. We'll be able to take our first patient, and then we'll have to wait for the Medicare survey that will come out and the state survey to make sure that we're all up to par and get the final approval, and then we'll be taking more patients.
But in the meantime, you do have residential hospice at Emeritus.
Yes.
In Medina.
We have a small unit at Emeritus at Medina. It is 8 beds that we use as our hospice unit right now. And that is such a needed unit because sometimes when a person has a symptom that they can't get managed where they're living currently, with their approval, we can bring them into the inpatient unit, manage the symptom aggressively, and then it is our hope to send them back home to wherever home may be after that symptom gets under better control. So this will be a bigger unit now that we can take care of more people. And also we'll be able to have residential there as well for folks that maybe would like to live out their days there at the unit. So.
And will you allow, let's say, a family member's coming in from out of town?
Absolutely.
They could stay overnight with them?
Absolutely. We have that now, but again, the space is small, but we're very fortunate where if they have loved ones that want to spend the night with them, or, as you said, out of town and want to spend days with them. They have accommodations where they will have sleeping, shower facilities, being able to eat there, and just being able to have some quality of time that they spend with their loved ones there as well.
Great concept.
Yeah, it really is. With the new building, there'll be plenty of outdoor space for children. There'll be a play area. The employees have been working very hard, donating money to a labyrinth that will be on the property. Are you familiar with that?
What?
That is really a neat thing. I'm probably not going to say it exactly correctly, so forgive me, hospice staff. But a labyrinth is a walk-like area that has been, the concept has been for centuries. And it's a small pathway that can either be gravel or grass, many times it's brick, and you follow it, it makes a certain kind of pattern, and as you walk the pathway, you can reflect, you can pray. It's just a meditation just to get yourself back in tune. And there'll be benches and places along the way that people can sit and just take that whole concept in. It's beautiful. It's a relaxing thing that a lot of people do on a routine basis, and we're going to have our own, which we're real excited.
Awesome. Not only for the person that's living there, but for the loved ones that come and visit. I mean, they need to vent too.
And for the staff too, which I'm
True.
going to take advantage of that as well.
Special people working in hospice.
Yes, absolutely. Sometimes it's just nice to be out there and just reflect on nature and what's happening, and it's going to be lovely.
On that note, talk a little bit about the Bereavement Center.
Our Robertson Bereavement Center is a part of hospice in Medina County. Now with hospices, it's mandatory by Medicare that you have bereavement services that you offer. But we're real unique as that we not only offer them, but we have our own bereavement center. The center is there to offer any type of bereavement support for families and loved ones that have lost folks on our program. But our Robertson Bereavement Center is also a community outreach program. So anyone in the area that has any type of bereavement or loss or grieving issues can use the facility. You don't have to have had a loved one on the hospice program to take advantage of that.
Oh, okay.
Our bereavement director, Reverend Beth McGuire, runs the center along with, I believe there's 4 other people on staff with her. And she can come out, or her staff can come out. She does a lot of things in the community when there's been losses. When we've had the terrible accident at the fairgrounds a few years back, she she was out there to work with people, helping them to get through this or to experience their grief or their bereavement issues. Also, if there's any type of problems in the school systems, maybe with a suicide or a loss or a death, untimely death of someone, they have also gone out with that. So the community can take advantage of that, and I always encourage people to come on down and see what the center has to offer. They are listed on our website. We have a wonderful lending library of books, audiovisual tapes, any type of equipment that you might need for your grieving losses.
Oh, good, good, good.
And then besides that, they hold different events, different in-services. Sometimes they're just one-day workshops. Other times they might be a week at a time workshops on losses. Like for May, they hold a wonderful mother, if you've lost a mother in the last year, or a grandmother, for mother-daughter type workshops. Pet loss, that's one of the biggest ones, where if you've lost a pet, sometimes people feel funny talking about I lost a pet and feeling sad about that. And
They're a family member.
they're a family member as well, and it is a loss. Sometimes it's the only person they've ever had, or the only, I should say, creature they've had that loves
His
them.
best friend.
Absolutely. So there's a workshop on that, how to deal with that loss. Also with suicide losses, or even now in this economy, job losses.
Oh, I'm
There's just a
sure.
lot of good, most of the time free information that is offered. And then one thing that Beth does is in the summertime, she has a kids camp, which is offered to children that have lost a parent or a grandparent. I believe even one year she had a gentleman, a young fellow, that had lost a twin sibling.
Oh, wow.
So it's just a wonderful week workshop camp that the children come to daily. They come in the morning, they'll have their lunch there, and they have wonderful different offerings
Oh,
to help
that's
them express
terrific.
their losses and to help them understand and cope better with the losses. It's really well attended. Yeah,
Oh, that's good to know. See, I was unaware of that. So that's great.
we're very, very proud of that bereavement center, yes.
So my viewers need to check your website and see all that
Absolutely.
is available out there.
Absolutely. Would you like me to give you that website?
Give us the website.
Okay. It's www.hospiceofmedina.org. And just a lot of good information about hospice, about palliative care, about the thrift store, the new building, and also bereavement.
Awesome.
Yes.
Well, thank you so much for
Thank
being
you,
my
Lori.
guest this month.
Thank you for having me.
And when you're driving down 18, make sure you check out the new building. And I'm sure there's going to be an open house for the public. So
Absolutely.
make sure when you see that advertised, get there.
Yes.
Thank you so much for joining us this month on Golden Years. And we'll see you next month.
Welcome home, man.